So for many of you, you're hearing this term brain spotting. And it's a weird word, and it's this newer kind of therapy modality that we're using, and it's one that I really love using with clients, and it's one that it's kind of one of my go-tos in my practice. So instead of going into the sciencey stuff about it, which maybe I'll do another video about, I wanted to make a video to show you what it kind of looks like and to give you a little taste. So what we would do in session is you would come in with an issue, and that could be a memory, that could be a limiting belief, like I don't feel like I deserve good things in the world. It could be I feel like I'm a failure, I'm a fake, I'm a phony. It could work for imposter syndrome, it could work for creativity blocks, it could work for so many things. So you come in with the issue, specific or broad, doesn't matter. And when you're talking about the issue, where I'm going to ask you questions that get you kind of worked up. So I want to give you a second to think of something small. So we're not opening any big Pandora's box right now. Think of something small that bothers you. It could have been a conversation you just had with a friend or a loved one. It could be a nightmare that you have and the way it makes you feel when you wake up in the morning. Something kind of like bite-sized in terms of issues. So I want to give you a minute to think of that. And while you're thinking about it, I want you to try to connect with it. Really try to bring it into the present moment. If it's anxiety, you might notice your heart starts to race. If it's anger, you might notice your hands start to flex. So we check in with the body as well. So just notice while you're focusing on that topic, how you feel and how your body reacts. And while you do that, I'm going to put the pointer in 3 places, and I want you to notice for yourself where you feel the most connected to the body sensation or the most connected to that emotion or memory. So I get out my pointer. I want to start here. So if you focus on it, just look at this for a second and see what you notice. Okay. Now I'm going to put the pointer right in the middle and see what you notice. Now I'm going to put the pointer over here and see what you notice. Now between this spot, and this spot, you probably notice something shifted in you. That's brain spotting. It gets a lot more complicated than that. It gets a lot more fun than that. And it gets a lot more creative than that. So I just wanted to give you a little taste. And if you are someone who you're like, I didn't notice anything, then what we would do is something where I would take this and I would move it really, really, really way slower than this even. And I'd have you focus on it, and I would watch you watch it to see what changed in you. So some people will blink really fast. Some people, their mouths will twitch a little bit. Some people will start to kind of flex. Some people's breathing gets heavy, right? In my own brain spotting, I've actually jumped out of my chair because it hit a spot that I didn't know was there. So we use this technique when there's less ability of someone to have awareness of what's going on inside of them. So while you look at it, I'm looking for your body to tell me what's going on inside your brain. So I could geek out about this all day, but that's just my little demo. So if you want to learn more about it and see if it would be a great approach for you to try, because maybe you're sick of talk therapy, or maybe you want to try it in addition to talk therapy, let me know. Reach out, send a message, and hope you enjoyed the exercise.